Good evening, everyone. Join me in taking a deep breath in and out. We all have to breathe to survive. And in fact, during this 15-minute talk, you'll take in between 75 and 120 liters of air, which is the equivalent of 7 to 11 party balloons of air. Over the course of the day, you'll inhale approximately 8,000 liters of air. And with each breath, the air pollution around us has the potential to impact our health. And it was that impact that I felt on my bike commutes to SFU in 2007. It was that chest tightness and wheezing that led me to research exercise, air pollution, and health. Air pollution is bad for us. It affects our heart, our lungs, our brain, and many other systems in the body, and it knows no boundaries. In fact, in 2019, one study estimated that air pollution was the 4th leading risk factor for global death worldwide and contributed to almost 7 million deaths worldwide. And given that most of us don't have the luxury of moving just because of poor air quality, what we can do to manage our risk is important to think about. And this is particularly important to think about in an era of climate change. Climate change and air pollution worsen one another. For example, increases in air pollution worsen climate change by increasing the heat-trapping gases that warm our climate. As the climate continues to warm, increases in ambient temperatures and dry conditions increase the likelihood of extreme air pollution events such as wildfires, which increase air pollution. So as climate change continues to evolve, the likelihood of air pollution events increases and smoke is more likely to blanket where we live. As air pollution increases, physical activity decreases, and also the likelihood of stress and anxiety also increase. In fact, in a study that we conducted, we asked people about physical activity and mental health during a wildfire smoke event and during a smoke-free time. Not surprisingly, during a wildfire event, people commuted more by car and less by bike. Also, walking, moderate and vigorous physical activity was significantly less during a wildfire. What's interesting about this is people also said that they moved more of their exercise and physical activity indoors. But even though they did this, physical activity was still less. Unsurprisingly, stress, anxiety, and depression were all higher during a wildfire event. And we found that reductions in vigorous physical activity were associated with increases in stress, anxiety, and depression. So as climate change-induced events are more likely to occur, what can we do to manage our risk in relation to air pollution? And how can we manage this so we can continue to be physically active during these events? And based on that, today I'm going to talk to you about the role of exercise and physical activity in helping us manage that risk during air pollution events and as the climate continues to warm. I previously mentioned that air pollution was one of the leading risk factors for global death. And what this figure shows me here, if you look to that central blue bar in air pollution there, it says that cardiovascular disease is one of the leading causes of death from air pollution. Now, we know that being physically active reduces your risk of cardiovascular disease. But what is interesting is that those who have pre-existing conditions such as cardiovascular disease are more likely to experience adverse health effects from air pollution. So, if you become physically active and reduce your risk of cardiovascular disease, then you stand the chance to secondarily minimize the risk of air pollution exposure. So in this instance, in this example, it's not just thinking about what you can do while there's an air pollution event. It's about preparing your body to be the most resilient that it can be when those events occur. In Canada, we're lucky enough, for most of us, that we live in areas with good air quality. And this graph here shows you the percentage of Canadians who live in areas with air pollution that is below air quality standards, which is a good thing. But what about if you live somewhere where air pollution is high? Should you exercise? Many of you will know that as you exercise, you breathe more heavily. And with that, you're going to increase the amount of air pollution that you take in. So does that mean then that you're increasing your risk of adverse health effects from air pollution? Despite the theory suggesting why exercising in air pollution would put you at risk, overwhelmingly, public health modeling studies suggest that the beneficial effects of exercise outweigh the risks of air pollution exposure. For example, in one cohort study, highlighted in bold here at the bottom, which involved 57,000 people, they explored the relationship between physical activity and risk of myocardial infarction. And they found that the beneficial effects of exercise on myocardial infarction were not modified by the increased dose of air pollution that people experienced. Another modeling study looked at how different levels of active transportation affect the risk of all-cause mortality or death. And they took into account here the increased dose of air pollution that you would experience with this active commuting. And they found that there was no major harm associated with active transport unless heavy pollution occurs or exercise lasts for several hours per day. To be specific, what they found was that even in areas with high background concentrations of air pollution, cycling for 75 minutes a day or walking for several hours a day would still reduce your risk of death. So this means the take-home message is generally for most of us, being physically active is beneficial and is beneficial to us in air pollution events. In Canada, the personal dilemmas that we most often face are very similar to this year and very similar to what many residents here in Kelowna, pictured here, would have experienced, where you feel trapped indoors or trapped by the dilemma of whether you should be physically active or not. And this dilemma was very, very prevalent this year in Canada, where we experienced one of the worst wildfire records in history. This graph here shows you the annual hectares burned in Canada, and when I layer on 2023, you can see that almost 18 million hectares burned in Canada. So when moving is integral to our well-being, and being outdoors is really integral to your health, what should you do? Especially, what should you do if smoke blankets where you live? The first thing that you should think about is, can you move that run onto the treadmill? Can you move that ride to the spin bike inside? And if you can, do so. Just make sure the doors and windows are closed and that you have something like a HEPA filter running to clean the air. Because if the doors and the windows are open or the HEPA filter's not running, it means that what's outside is inside, and it'd be similar to exercising in the smoke. For some of us, the thought of running on a treadmill or hitting a spin bike is about as enticing as putting a sweater on during a heat dome. So if you fall into that category, and it's smoky outside, should you tame that exercise session, and instead of going for a run, should you go for a walk? Now, unfortunately, as with a lot of science, it depends and there's not necessarily clear data. But the available evidence that we do have suggests that exercising harder may be no worse for you than sitting on the couch. For example, in a study that I conducted, we had people exercise in either clean air or a simulated air pollution environment, and they either rested or performed low or high intensity exercise. And overwhelmingly, what we found was that exercising harder in air pollution may not be any worse for you than exercising moderately or resting. And we measured a number of different physiological variables, and with all of them, we did not find that exercise intensity made the effects of air pollution worse. So what this tells us is that if your run means that you are out for a shorter duration than, say, that long walk, you may actually have lower exposure and therefore a lower overall health risk. But bear in mind there are limitations with these studies, such as smaller sample sizes, homogeneous groups, limited time frame. But to date, they are the only real studies that ask the question, should we modify how hard we exercise when it's smoky out? If you choose to go outside and exercise, let your symptoms guide you. If you experience symptoms of air pollution, such as chest tightness, wheezing, or shortness of breath, these are not to be ignored. You can plan activity and workouts around typical diurnal variations in air pollution. We know that in the summer months, ground level ozone is lower in the mornings. So you can plan your workouts to happen in the mornings during the summer months because ozone will be lower. If you can, move your workouts away from major roadways. If you're not able to move yourself away from major roadways, even moving from roadside to curbside will decrease your exposure to traffic-related air pollution. Using things such as the Air Quality Health Index, which can provide you with current air quality concentrations, as well as forecasts about air quality concentrations, can help you plan when it's good to be physically active. In conjunction with apps like the WeatherCan app, which can send you alerts when concentrations of air pollutants exceed a certain threshold, these two tools are great to have in your toolbox to help plan activity around when you exercise or are physically active. What about masks? Well, in healthy people, there is no harm in wearing a well-fitting N95 mask to try and reduce your overall exposure to air pollution. If you are somebody that has a pre-existing lung disease, then please consult your doctor first. What people often don't think about, though, is that there are 23 and a half, 22 other hours in the day at which you're exposed to air pollution. So thinking about what you can do during those times to reduce your overall exposure is important. So if you're popping out for an errand, if you're commuting in your car, if you're taking your dog for a walk, can you wear a mask during that time? Also, the place where you work or the place where you live, having a HEPA filter running, a portable HEPA filter running at home will reduce your overall exposure to air pollution during wildfire events. Now, it's not just what we can do as individuals. Municipalities and governments have a role to play in help protecting and minimizing our exposure to air pollution. And one thing that they can do is provide clean air shelters for people who don't have access to a clean environment during a wildfire event or an air pollution event. Thinking about free or low-cost access to things like N95 masks, as well as free or low-cost access to exercise facilities during a wildfire event, would be an important way to reduce barriers to keep people physically active while also helping reduce exposure. If you work somewhere that has an automatic opening and closing door, disabling that function is going to reduce air pollution inside, because most of what's outside comes inside. And municipalities can think about campfire bans in the summer months or throughout the year, so we can reduce the overall burden of air pollution exposure. I want to leave you with these thoughts. As the climate continues to warm, will we be hit by the double hammer of air pollution trapping us inside, and then extreme heat trapping us inside and reducing our levels of physical activity? One study estimated that over a third of warm season heat-related deaths were related to human-induced climate change. as temperatures become more extreme, people become less physically active. And this is concerning because those with lower level of fitness have less heat tolerance. And those with lower levels of fitness have an increased risk of cardiovascular disease, and those with cardiovascular disease are more at risk of the adverse effects of extreme heat. So with climate change, are the effects of air pollution on health going to be amplified by increases in ambient temperature and then further amplified by decreases in physical activity? We don't know. We currently don't have any research looking at how high concentrations of air pollution in addition to high levels of extreme temperature affect our health, particularly during exercise. In theory, being physically active can help manage our risk during climate change, but empirically, we're not there yet. Thank you.